The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi folks, and welcome to Aging Horizons. On today's show, we'll be talking about Medicare and You. Actually, that's a title of a booklet that you should have received in the mail if you're a Medicare beneficiary. It explains Medicare for 2023. There's been some changes, and some have not been changed. Open enrollment is from October 15th through December 7th. We're in the middle of it. We'll show you how to evaluate your plan, so stay tuned.
A decade of Montana fourth graders on Energy Share. Not having enough heat in the winter can feel like you're at the mercy of the elements. Energy Share will help keep your family safe and warm even in the coldest weather. Montanans are always ready to lend a hand for our neighbors. No one deserves to be cold in the winter. Like Kaylin Perkins says, Energy Share is like love filling the air. Energy Share is not a government program. It's neighbors helping neighbors who face energy emergencies the Montana way. Call or visit our website today. No fear, Energy Share is here.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare Summary Notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
Good care is your right. In Montana, there's over 11,000 beds in nursing homes and assisted living facilities. If you or a family member needs assistance or help in obtaining information about care issues and placement options, call 1-800-332-2272. If you or a family member need information about Montana's long-term care resident rights, or if you need help solving a problem or a complaint about a nursing home or an assisted living facility, call us at 800-332-2272.
Providing long-term care for someone in need is a labor of love, but it is a labor. Time apart is healthy and necessary both for the caregiver and the person receiving care. It allows each a respite, time to relax and recharge. If you're a long-term caregiver, visit the new Lifespan Respite website. Financial assistance may be available. Respite for caregivers. It's okay to need it. It's okay to want it. It's okay to get it.
Hi folks, and welcome to Aging Horizons, which is brought to you by the Department of Public Health and Human Services. I'm your host, Brian Lamore. I mentioned we're talking about Medicare and You. It's a pamphlet you should have received in the mail for the open enrollment period of October 15th through December 7th. You have the opportunity to evaluate the plan that you're on and plans that are out there and changes in the Medicare plan, which can better help you address maybe any medical issues or possible ones you might be concerned about. Of course, joining us today is Janet Stellman. You're behind-the-scenes worker for Aging Horizons. You're the Montana Ship Director. Welcome to Aging Horizons.
Thanks for having me, Brian.
Great. You know, we're talking about what's new in 2023 with Medicare. Please update us.
Well, there's some exciting changes coming to Medicare. Yeah. The first off is that the Medicare B premium for the first time in years is actually decreasing by $5.50. So
down.
This year it was $171 or something like that, and next year it's going to be $165. So it's going to go down about $5. Okay. Same with the Part B deductible. It's going down $7. So last year it was $230 something, and this year it's going to be $226. So it's not a big change, but at least it's going in the right direction, huh?
Right. Well, it's about $150 a year that it's gone down, and nothing goes down anymore, does it?
Yeah. So that's the biggest thing when we just found out that last week, so that's exciting. Also through the Inflation Reduction Act, which was passed in August, I believe, it is capping insulin for people with diabetes. So it's capping it at $35 a month, which is a huge savings if you know how much insulin costs. So that's going to be great. Another one that's coming up is simplified enrollment. So it used to be that if your initial enrollment period is the 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after. And if you enrolled anytime the month of or after, it would take a couple months to start, or you wouldn't be eligible for a couple months. Now it's going to start the month after you start it. So if you apply in your birthday month, it's going to start the first of the next month. So you're not going to have to wait a couple months for that. Same with those people who didn't sign up for Medicare when they were first eligible for. The open enrollment or the general enrollment period for Medicare is January 1st through March 31st, okay? And so those people that signed up during that period, their coverage wouldn't begin until July 1st, but that's changing now. So if you sign up in February during the general enrollment period, your Medicare is going to start the next 1st of March.
Oh, great.
So you're not going to have to wait for July. You're not going to incur any more penalties waiting to get on Medicare. So that's really big. Another one is those who have had kidney transplants and are on immunosuppressant drugs. It used to be Medicare would pay for those for 30 months after a transplant, and then Medicare would end. So those people who weren't eligible for Medicare otherwise, they would just end and they'd be responsible for their own immunosuppressant drugs. Well, now they've started a new thing starting on January 1st. So those people that have used their 30 months under Medicare can get continued coverage under a special Medicare plan. So if they don't qualify for any other Medicare, they can get on this special Medicare plan and pay for, I think it's like $95 a month, but it will continue to pay their immunosuppressant drugs. That's it. That's all it will pay, but at least they're going to have that coverage for those medications. So that's so expensive. So it's a special Part B program because those are paid under Part B benefits. So
now, will that take a special enrollment process or something that the beneficiary has to do to start getting that benefit? Or?
Well, they'll definitely have to call Medicare and set it up. So when their 30 months comes close, or you can call a SHIP counselor too, because we can tell you about it.
Yes.
So, but that's exciting because those are expensive medications. The last one I want to talk about real quick is the elimination of the cost sharing for some vaccines under Part D. So instead of when you go get your shingle shot, instead of having to pay a cost share and meet your deductible and stuff like that, there's going to be no cost sharing on that. So you're just going to be able to get your important vaccines that are under Part D.
That's great. Well, now I need to get my shingle shot. Well, when does that kick in? Is that January 1st?
Yeah, that will be January 1st. All of these that I've talked about are starting January 1st. So, so, and there's going to be more changes rolling out because the Inflation Reduction Act that was passed in
this year?
August, yep.
Yeah.
But they're not going to take effect until 2024, 2025, 2026. So, but they're going to be like capping Medicare beneficiaries out of pocket at $2,000 a year. It's going to expand the extra help program for prescription drugs. Those people that are maybe only getting partial now, everybody's going to get the same, you know. So there's definitely some exciting changes coming with the Inflation Reduction Act that was passed.
For 2023, but we have a resource that's available in Montana. There's someone in every county. Quickly, can you tell us a little bit about the SHIP counselors?
Right, so SHIP stands for State Health Insurance Assistance Program. We are funded through the Administration on Community Living. Most of our SHIP counselors are around the state in the area agencies on aging that we have, the 10. There are about 150 counselors across the state. They may not live in every single county, but they cover every single county. So they can help you with your Medicare issues. And they're free, confidential, unbiased,
and knowledgeable.
So give them a call.
Give them a call. Folks, our SHIP director, which is Janet, but we have these SHIP people throughout the state health insurance and assistance program. They'll help you evaluate the plans that are available. They won't decide for you, and they have nothing on the shelf to sell you. So that's really important, and they're very knowledgeable. We'll talk about them and so much more in our next segment, so stay tuned.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
Here in Montana, we love our outdoor activities. Unfortunately, few of them are risk-free. Indeed, Montana is second in the nation per capita in head injuries that can destroy the lives of people we love. That's why you should insist your family always wear protective helmets. But you can do even more. When you fill out your vehicle registration this year, circle the Y and donate $1 to support traumatic brain injury prevention and education. Now that's using the old noggin.
I was angry and upset when the doctor told me I have diabetes. I just didn't want to deal with it, the needles and the diet restrictions. But after I started to learn about it, those feelings changed. I was at risk for a heart attack caused by high blood sugar. That got my attention. I started watching my diet and making sure I got enough exercise every day. I want to be around for my grandkids, and now that I know what to do, it seems like a small price to pay.
Ask your doctor about diabetes education or visit montana211.org.
Hi folks, and welcome back to Aging Horizons. I'm your host Brian Lamore, and we're continuing our discussion about Medicare and You. It's a booklet you should have received in the mail that defines Medicare for 2023. It's a wealth of information, it's an easy read, and it tells you how Medicare has changed. Now Janet, we have an open enrollment period from October 15th through December 7th. What is an open enrollment, and why is it important for Medicare beneficiaries?
Okay, so we're right in the middle of it right now.
Yeah.
Open enrollment is a time for Medicare beneficiaries to reevaluate their Part D coverage, their drug coverage, or their Medicare Advantage plan if they want to get into a different Medicare Advantage plan. Because what was good for you this year may not be the best for you next year. They may change their formulary, they may change their coverage, they may up the premiums, they may quit covering, like I said, one of your drugs. And so it's really important to evaluate that each year because usually most people are in that plan for the whole year. So you want to make sure that you're that you're checking that out based on what drugs you have and what your healthcare needs are to make sure that you're getting the best plan for you for 2023.
Right. Well, now you're talking about Medicare Advantage plans, and that is an optional plan with an individual can choose to go under, and there's various companies that are authorized to offer plans in Montana. And at the end of the year, right now, you can opt for another plan. But what do you look for when you're thinking, does this plan meet my needs, does this one not? I looked into 2, maybe there's 7. It sounds like it kind of gets confusing after a certain point.
Right.
So what is an Advantage plan, and how do we properly evaluate, and how do we pull in a ship counselor to help us out?
Okay, so Medicare Advantage plan, there's a traditional model of Medicare where you get your A, B, and you sign up for a Part D plan, a drug benefit, and maybe you have a Medicare supplement. The other way to get your Medicare is through Medicare health plans or Medicare Advantage plans. That's when Medicare gives a pot of money to these companies like Humana, United Healthcare, stuff like that, Blue Cross Blue Shield, yes, and says, here you go, we're giving you this pot of money, you're going to take care of their Medicare benefits, okay? It has to cover everything that regular Medicare covers, but it may cover things in a different way. So traditional Medicare is 80-20 split, whereas Medicare Advantage plans, you might have a $10 copayment every time you go to the doctor, or a $300 cost share when you go to the emergency room. Where over here with traditional Medicare, it's going to be 80-20. One of the nice things about Medicare Advantage plans is they have a maximum amount of pocket. So if you have a lot of medical expenses that month and you get to like anywhere from $4,500 to $10,000 depending on the plan, there's a cap on how much you're going to be responsible for, and after you've hit that, then the plan's going to pay the rest. So it's kind of protects you from outrageous medical bills. So during open enrollment, you have a chance to evaluate that, or if you're not in the Medicare Advantage, also the Medicare prescription drug plan. The important thing to look at is, one, is what drugs you take, because that's going to determine it, help narrow it down to what you want to get into, and what kind of coverage you want. Do you want to be in a Medicare Advantage plan, or do you want to be in traditional Medicare? So there's a couple ways to get that help. One is, if you're good at the computer, you can go to Medicare.gov and create an account. Once you create an account, you're going to be able to see your personal information in that secure login spot. And it's going to bring up a list of all the drugs you've gotten in the last year. And so you would just go through that list and determine which ones you're still taking and which ones you're not taking anymore, and then follow through. It's pretty self-explanatory. And then you'll get to the results page, and the first thing, what it does originally is it sorts them by the lowest annual cost. So therefore, the first one that pops up based on your drugs should be the cheapest plan for you. So you can look through them all and make sure that it's covering all your drugs. Look through, if it's a Medicare Advantage plan, you can look at the drug coverage there. Also, what kind of what the maximum out of pocket is for the Medicare Advantage plan, what the provider network is, and what your costs would be.
As you run down those points, to me, my first thought is, this sounds kind of complicated, particularly if you have some health issues to try to figure this out. But it's important to evaluate, what I'm hearing you saying is where you are now and anticipate next year. Right. Will your health conditions worsen or get better? But the important news is we have a person to help you out that understands this. Right. Tell us more about the SHIP.
So that's really, that's kind of confusing. It really is. Yeah. There are SHIP coordinators or SHIP counselors around the state that are there to help you, guide you through those choices and run that plan finder for you. And they're not going to tell you which plan to take, but they're going to show you what's available and, kind of outline the plans for each other. Since we are in the middle of open enrollment, it's really important to call your SHIP counselor as soon as possible to see if they have any open appointments. Yeah. If not, it may be that you'll have to call 1-800-MEDICARE this year, but in future years, make sure you're calling early to get those appointments to help. So
now you talk about an appointment. This could be a telephone appointment, right?
Right. It can be a telephone appointment. It could be a video appointment, like a Zoom meeting, or it can be in person.
Yeah.
So
that's great. Well, they have all kinds of ways to help you out that are available, and they can hopefully do it quickly. And it's important to note, too, if this is a little confusing for you still, bring in a loved one or a trusted friend or a health professional to sit down with you and help work that out to figure out what is best. But it's important to know here it's your decision. Somebody else isn't going to decide for you. They're going to help you collect the facts and show you some options, and then you decide. Well, we got a lot more great information. Stay tuned. We'll be right back.
I was outside working on some equipment, nothing too strenuous. I started sweating and feeling out of breath.
When he felt pressure in his chest and aching in his arms, I knew we had to call 911.
First responders were there before we knew it. 38 minutes later, the doctors had restored the blood flow to my heart.
Now we know dialing 911 saved his life.
Your life is on the line.
This message sponsored by Mission Lifeline Montana.
I take care of my wife at home. When I found out training was available, I said, sign me up. It's made a huge difference.
When my husband was injured at work, it was life-altering. The classes taught me that it's okay to grieve, to ask for help, and to better cope as a caregiver.
My dad lives 4 hours away, and the Powerful Tools classes taught me that it's okay to ask for help. I highly recommend them.
To find out about this course for caregivers, go to powerfultoolsforcaregivers.org.
It's amazing the difference a little training can make.
Out here, we love our animals. From the wildlife
to the livestock. Inside, it's the same. They're just like family. We keep them happy and healthy, most of the time. Secondhand smoke puts pets at risk for cancer, feline lymphoma, vomiting, increases the risk of tumors and lung cancer, even causes eye and skin disease. Secondhand smoke puts your pet's life at risk.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
Welcome back to Aging Horizons. I'm your host, Brian Lamore. We've been going over Medicare and You, a book that is available and has been received by most Medicare recipients by now. We're in the middle of the open enrollment period, which is October 15th through December 7th. And there's just a little bit of time to contact your SHIP counselors or to review and evaluate the plans that you have. But there is some good news. If you can't afford some programs or some parts of Medicare, there are some helping programs that they're called. And Janet, there's a number of them. What are they and how do they help the various beneficiaries?
Right. So there's a couple different programs that are available to beneficiaries. All of our SHIP counselors across the state are, they realize the importance of those programs, and so they're going to screen you for those programs. The first one I'll talk about is the Low Income Subsidy, or LIS it's called, Extra Help. It is through the Social Security Administration. It's a program to help you with your Part D or your drug benefits. So they say the average beneficiary will save like $5,500 a year on it, but we've seen it significantly higher than that. I mean, we're talking about tens of thousands of dollars. Wow. So what it does is it's income and resource based, and so if you're eligible, you're going to have a reduced premium or a zero premium depending on what plan you pick. You're going to have co-payments anywhere from $1.25 to 15% of the cost. So some significant savings there. You're not going to have a deductible. There's not going to be any coverage gap for you, and then once you've spent so much out of pocket on your drugs, you'll go into the catastrophic coverage, and then it's only you pay 5%.
Wow,
so
that's great.
Big help. And then so that's a good program there. The other one is the Medicare Savings Program. That's it's a Medicare program, but it's administered by the Medicaid office here in Montana. There's 3 levels of that: QMB, QMB, SlimB, or QI. So QMB is the Cadillac model, but it's also for the people with the lowest income and resources. So those people get, if they have a Part A premium, most people have premium-free Part A, but there's some people out there that maybe they don't have enough work quarters or they can't draw on anybody else, and so they have to pay for their Part A, which is like $450 a month, just the premium. So if they're on QMB, QMB will pay the Part A premium, the Part B premium, that $171 or $164.50, whatever it is for next year. And it'll also pay that 20% that Medicare doesn't pay. So remember I said Medicare pays 80 and the beneficiary is responsible for 20. Well, with this program, it'll pay that 20% too. So I mean, it's a great program. The other ones for the little bit higher income folks is SlimB, and it will just pay the Medicare B premium. So that's $164.90 back in your pocket,
every month.
Yep. And so they say that's an average savings about $2,300 a year. So I mean, what would you extra $160 for you to pay bills, go out to lunch, buy your grandkids presents? That's quite a bit per month. And then there's another program that's a little bit higher income, even more, that will help pay that Part B premium too. So that's called the Medicare Savings Program. The final program is Big Sky RX. It was created during the Schweitzer administration, so about 2006, I think. It's a program that, through the Medicare Modernization Act, through that act is what brought prescription drug coverage to Medicare. There had not been any prescription drug coverage in Medicare since it was started in 1965. So part of that Medicare Modernization Act created a state pharmaceutical assistance program. And so Montana's this Big Sky RX. It was funded with tobacco tax. And what it does is it pays a part of somebody's premium up to like $38 a month, and it can pay the company directly, or it can reimburse the person right directly into their bank account. So it's for people with a little bit higher income and resources. So maybe they have quite a few resources, things they own that would make them ineligible for the other programs, but Big Sky RX doesn't look at resources, so they're just going to be looking at the income.
Oh, that's great.
And so then it will pay up to $38 a month. So it's not a lot, but it's a little bit of help. Yep.
Well, you know, Janet, there are people that can go on the internet and they'll hit one of these programs, they'll look at it, oh, I'm not eligible. But it's possible you could be eligible for multiple programs, and they all have different qualifications. If you're not eligible for one, doesn't mean you're not eligible for all, which means that you get someone to help you, like the SHIP counselor, and they can help you with prescription programs, but they can also help you with the Area Agency on Aging programs, right? There's more that's available.
Yes.
What are some of those programs?
Well, there's through the Area Agency on Aging, there's information and assistance counselors. They help link seniors or people with disabilities up to services in the community. So if they need rental assistance, or they need heat assistance, or whatever they may need, they may have the resource for that to direct somebody to where to go to get some extra help.
Right. Well, it's important is that they have the knowledge of other programs that you could be eligible for: Meals on Wheels, Senior Center, Ombudsman Program, Legal Services, home delivered meals. So by talking to them, you get a wealth of information and programs through the Area Agency on Aging.
Right, because the majority of our SHIP counselors they do wear multiple hats, and one of them is they are trained in, information and assistance and helping people.
That's great.
So give them a call.
Yes.
We'll put the number up on the screen.
They want to help you. Well, Janet, thank you so much for being on the show and explaining these programs to us. And for our viewers, we've been talking about the importance of Medicare and You, and utilizing the October 15th through December 7th open enrollment period. If you don't make a decision, you will get, or you've changed your mind, you'll get last year's program, which you're already on. So thank you for joining us. See you next time.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.